Good evening, everybody. Again, this is Dave King. I wanted to share video number 1 of my periodontitis review project. I've spent a lot of time reviewing a bunch of different articles, talking about a whole bunch of connections and links and issues and outcomes as it pertains to gum disease, gum infection, periodontitis, trench mouth, pyorrhea. There are a bunch of other names you've probably heard before. But today we're talking about this article, which you can see here on the screen in front of you, what's on the screen is my marked up copy that I scanned. So I apologize, it's a little bit grainy in a few spots, but let's go through it. I felt like it was apt to start with something that specifically references COVID-19, since that's what we're all dealing with, and finally some of us at least, are finally starting to head back to more normal situation. So this particular study was accepted into the Journal of Clinical Periodontology, 24th of January 2021. I printed this off online. It's totally free and available. I'm going to jump through a couple of points here, talk about the conclusions, some of my thoughts about the article itself, and hopefully won't take too much of your time here. So let's look straight to the conclusion here, right at the center of that page 1. Periodontitis was associated with a higher risk of ICU admission, need for assisted ventilation, and death from COVID-19 patients, and with increased levels of biomarkers linked to worse disease outcomes. So with regard to periodontitis, and we're going to read about that here, periodontitis has hallmarkers of systemic inflammation. It's one of the main characteristics of periodontitis. So we know that periodontitis, active gum disease, elevates systemic inflammation, which causes all sorts of issues in the rest of the body. We know that the head, the mouth, is connected to the body. And so we have to be cautious and focus on what's going on, especially in the gums. There's a whole lot of real estate in the gum tissue itself. So if we ignore the gum tissue and just focus on the teeth as dentists, then we're going to miss out on opportunities to help our patients get a lot healthier. So systemic inflammation is what we're talking about. We know from all sorts of studies out there, not the least of which is, Dr. Bale and Doneen, talking about, how the increased risk of heart attack is 2 to 5 times the increased risk if you have active periodontitis. So let's read a little bit through the introduction here. So as we're reading, I want you to kind of pay attention to some of the highlights that I've made. I've added a couple of my thoughts and just wanted to share again what stands out to me. I'm certainly not I haven't written many articles. I've had one study, not a study really, it was an article published. So I'm certainly not an expert as it comes to reading articles, although I have read a lot, hundreds probably of articles. So we read here that 50% of adults are affected by mild to moderate periodontitis. 10% by the severe form of the disease, rendering periodontitis the 6th most prevalent condition affecting mankind. That's tremendous. This is incredibly common. We also know that the disease, periodontitis, is characterized by chronic non-resolving inflammation in response to a dysbiosis of the subgingival biofilm. That basically means that the natural biofilm, the bacterial biofilm that sits around the teeth down below the gums, breaks down. And the chronic inflammation frequently leads to a low degree systemic inflammation and increased levels of cytokines such as TNF-alpha, interleukin, 1 beta, IL-4, IL-6, IL-10, as well as CRP and ferritin. And we know also that interleukin 1 here, hiding behind my head here, IL-6, and CRP and ferritin are also directly connected to worse outcomes as it pertains to COVID-19. So I'm just going to move myself over here. We're going to go back to single page here, and I'll put my head back over here where it's supposed to be. All right, let's look at these one page at a time. I'll zoom in just a little bit here. So COVID-19 mortality has been associated with elevated levels of IL-6, CRP, D-dimer, and ferritin. We know this now, right? Okay, so in the study design, one of the things that kind of stood out to me is how they defined periodontitis. They defined it strictly based on radiographic bone loss. That's the only thing they were looking at. So as the examiners went in to look at the data that they referred from, they were looking specifically at radiographic bone loss when detected at 2 or more non-adjacent teeth. So I've written very broad, meaning that they've excluded a lot of patients with potential periodontitis. For me in my clinical practice, I'm measuring, probing, 168 locations for a patient with 32 teeth or 28 teeth, probing all these spots. And that's generally where I make my most profound clinical determination, is on the numbers, the periodontal probing depths. So when we're talking about just looking at x-rays, we are going to miss a large population of the people with periodontitis. But for our study purposes, that actually kind of solidifies and strengthens the connection that the patients with the worst systemic gum infection, thereby elevating the systemic inflammation in the body, have worse outcomes as it pertains to COVID-19. So here are some of the markers again: D-dimer, CRP, HbA1c. As we go through here, we're talking a little bit more about how they completed the study. After adjusting for periodontal confounders, periodontitis was significantly associated with overall COVID-19, as well as complications, ICU admissions among diabetic patients, non-smokers, and patients 18 to 40. In addition, periodontitis was also significantly associated with the need for ventilation among non-smokers. So we know now that there are significant connections between patients that have periodontitis and patients that had all these negative outcomes as it relates to COVID-19. Try to bring this full page on here. There we go. So in the study data, I'm kind of jumping through this really quickly. It's 9 pages of information. It's a really good study. You want to take the time to read through it. I don't personally have a really strong grasp on the numbers, so I'm focusing on what really stands out to me. As we talk through the discussion, this study identified that the risk of COVID-19 complications was significantly higher among patients with moderate to severe periodontitis. So there's a connection. Now, exactly what that connection is has yet to be completely determined, but they talk about some factors here. The CRP, IL-6, D-dimer, ferritin, these things are connected. So as your body elevates those interleukins and the D-dimer, C-reactive protein, all this stuff, your risk of COVID-19 difficulties increases. So periodontitis, we know, causes those things. So it follows suit. That if you have advanced gum infection and carrying a significant amount of inflammation, you're going to have these issues, at least a potentially higher risk of these issues with COVID if your body is exposed to it. Okay, after adjustment, so all these numbers get crunched, right? They measure all the patients. We have all these patients. Let's see, the number of surviving patients, the number of deceased patients, non-ICU patients, ICU patients, no ventilation. After adjustment of confounding factors and potential issues, which again goes deeply into statistics, and to be honest, that was not my strongest class. I took that class at Central Missouri State University in 1999? No, it would have been 2000. And I passed it, but I did not enjoy it. It was a painful experience for me, so statistics is not my strong suit. But they take some time, they go through, they look at the confounding factors, and they adjust the numbers to account for some of those factors. And after adjustment, periodontitis still had a significant impact on the course of COVID-19 infection, with significant associations with COVID-19 complications. And the odds ratios are listed here. If we look at the next page, I think the odds ratios are here. So if you have stage 0 to 1, which is the early onset periodontitis, the odds ratio is 1. Basically, if you're early onset periodontitis, your odds ratio of having a negative outcome, the chances of you having a negative outcome with COVID-19 complications are the same as people without periodontitis. So that's the 0, right? So let me clarify that. If you have no periodontitis or mild periodontitis, stage 1 out of 4, then you have the same odds ratio, the same potential risk of having a negative outcome. However, when you go from past the mild to moderate to severe, your odds ratio goes to 3.67 times the ratio of people that don't have it. So it seems fairly obvious based on these numbers that as you have more advanced periodontitis, your potential to have a negative impact, a negative outcome, difficulty, survival, admission to ICU, ventilation needs, goes through the roof. You know, we're 3.6 times the rate for patients who do not have periodontitis or have mild periodontitis. Death for those who had, moderate to severe periodontitis was 8 times as likely of the patients that did pass away. 14 deaths of all the patients that were calculated, 14 deaths of those 14 that died, most of them had advanced gum disease. The ICU admissions, 3.5 times as likely to be admitted to the ICU if you had mild or moderate to severe periodontitis, and needed for assisted ventilation with a ventilator, to be intubated. 4.5 times the risk. So this blows me away. These numbers, assuming all the calculations, and we have to take some of this, we have to trust them to some degree, unless you have a statistics background and can go through and look at them all. This really blows me away, especially this 8.81 times odds ratio for patients who have died from COVID-19 in this particular study that had moderate to severe periodontitis. That is mind-blowing to me. So, it really supports the fact that this periodontitis dramatically increases the patient's risks of, in particular, COVID-19. So let's read through down here. Several hypothetical mechanisms may explain the strong associations observed between periodontitis and COVID-19 severity. Takahashi et al. Suggested that the aspiration of periodontopathic bacteria might aggravate COVID-19 by inducing the expression of angiotensin-converting enzyme 2, a receptor for SARS-CoV-2 and inflammatory cytokines in the lower respiratory tract. So basically what that means is if you have COVID-19 and you're breathing in the bacteria that's in your gums, which everyone does, you're breathing in that bacteria, it's going into your lungs, then it increases and induces the expression of ACE2, angiotensin-converting enzyme 2, which is a receptor for COVID-19 and causes the inflammatory cytokines to go crazy. That's that IL-6 and ferritin and C-reactive protein, all this stuff. Takahashi et al. Also suggested that periodontopathic bacteria might enhance the SARS-CoV-2 virulence by cleaving its S-glycoproteins. And Matapusi Balaji et al. And Takahashi et al. In 2020 that the oral cavity, specifically periodontal pockets, could act as a viral reservoir. So there are a bunch of reasons why these numbers that we looked at up here could be so significant. Whether we're breathing them in, whether they're causing, an uptick in the ACE2 and all the inflammatory cytokines, or some combination of both has yet to be determined. But it's really amazing to me that all this is happening. Also, Sani et al. Suggested that the strong Th17 response in severe periodontitis could exacerbate the cytokine storm in COVID-19. So, all sorts of factors, right? Jumping down, our COVID-19 cases with periodontitis had significantly higher white blood cell and C-reactive protein serum levels than those without periodontitis, which may indicate a possible link of this association through systemic inflammation, right? Now, they mention one of the confounding factors, one of the limitations is using only one of the parameters, interdental bone loss, may limit the diagnostic accuracy, which is one of the things I pointed to. So I think, honestly, if we were able to capture more patients with periodontitis, we could potentially refine and dial in some of those numbers to be even a little more specific than we see here, these numbers here. But really, as I mentioned, all they did was they just measured the interdental bone loss. That's it. I'm using x-rays. They took sequential x-rays before and referred back to the patients that had in the database that already had x-rays. So they underreported periodontitis. Anyway, So let's go back to the conclusion right here, and I'll kind of wrap up. Periodontitis was significantly associated with a higher risk of complications from COVID-19, including ICU admissions, the need for assisted ventilation and death, and increased blood levels of markers linked to worse COVID-19 outcomes such as D-dimer, white blood cell, and C-reactive protein. So pretty amazing to me that we're now seeing more and more that periodontitis and the infection that's caused by two main big bacteria, Porphyromonas gingivalis and AA, Aggregatibacter actinomycetum comitans, these two bacteria, combined with others, are the big players in causing all sorts of issues that start in the mouth, in the gums, down in these little pockets in between our tooth and gums. 2 or 3 millimeters, 4 or 5. Once we get to 5 millimeters and above, things really start to cause issues for us, which in this study here, points out that we have a definite higher increased risk of negative COVID-19 problems based on the presence of periodontitis. So hopefully this has been helpful. Looks like we're going on 16 and a half minutes, so I feel like I've kind of been rambling. Please let me know what questions you have. Go ahead and comment. Let me know. The next study I think I'm going to do is, there are a couple of that I've read talking about heart attack and stroke risk, cardiovascular issues. There's one that links endodontic bacteria to heart attack clots, which is interesting. It's a little bit outside periodontitis, but some of those bacteria overlap. And then there's one that connects, which is really interesting to me, connects rheumatoid arthritis to periodontitis. A very strong connection. So we'll get through those hopefully in the next few weeks. I am out of town. I'm going to be on vacation next week. But I may be able to put up another video. But again, let me know what questions you have. Hopefully this has been helpful. Just really astounding to me how periodontitis, gum disease, can dramatically increase the severity of COVID-19 infection in patients that are susceptible. So thank you, and have a good evening.